In this video, we're going to address one of the biggest pain points that people encounter on their journey to become self-sufficient with their peptides, reconstituting a vial of peptides. In order to do this, we're going to need four things. We're going to need a vial of bacteriostatic water. This one is made by Hospira, which is a division of Pfizer. It's one of the best ones out there. I highly recommend it. Next, we're going to need an alcohol swab and a reconstitution needle. This one that we're using today is a 23 gauge, 1 inch long needle with a 3 milliliter syringe. And last but not least, you need your vial of peptides. Today, we're going to be reconstituting a 10 milligram vial of ipamorelin. The first thing we're going to do is we're going to take this plastic cap off the top and throw it away. All we got to do is crack it and pull it off. You'll feel, if you feel around on top here, you're going to feel some kind of stickly pricklies from where that top ripped off. What I like to do is take my thumbnail and just go around the top and kind of push those down and in. It's just aluminum around here, so they should bend pretty easily. And once I've done that, it makes it nice and smooth so that when I wipe my vial off every time, the alcohol swab doesn't stick and rip. Then what I'm going to do, take my alcohol swab and wipe off the top of both of the vials. That way they're nice and clean. We don't have any issues there. Now we want to take our reconstitution needle. This varies a little bit from the insulin needle that we normally use in that the top can come off. Okay, so the first thing we want to do is we want to make sure that this is screwed down tight so that it creates a vacuum when we go to pull the water out of the vial. The first time I did this, I didn't know to do that, and I kept pulling and kept pulling and kept pulling, and no water was getting into the syringe, and I got really dejected and thought I'd never be able to do this. But then I figured it out, tightened it down, and everything worked great. On the top of the vial, you'll see a little circle in the middle. We're going to go ahead and aim into there and just push in, and that's ready to roll. Now we're going to go ahead and pull this down, and you'll see that water kind of bubble in there, and then it'll just kind of stop bubbling and it'll be full. You'll notice that there's a vacuum in this vial. So if I go ahead and let that go, the plunger is just going to keep on going up. So what I need to do is pull this past my desired dose or desired volume. In this case, I want to put in 3 milliliters into this vial. So I'm going to go ahead and pull it way past the 3, if you can see that on there. And then I'm going to let it slowly creep up until it's right at the 3. And I'm going to put my finger right there. And then as my finger's holding it right where it needs to be, I'm going to slowly pull it out. Now I've got exactly 3 milliliters of water in my syringe. Typically ahead of time, I'll figure out exactly how much water I need to put in to the vial to make it the concentration that I want. What I like to do is make most of my peptides the concentration so that the dose I want is achieved in a 10-unit pull on that insulin syringe. So I don't have to remember this one I take 8 units, this one I take 10 units, this one I take 15 units. They're all pretty much consistently 10 units. Now, these peptide vials also have a vacuum. The vacuum in here is pretty strong. Every once in a while, one will get out of the factory without a vacuum. It doesn't mean that the peptides are bad, it just means that they lost the vacuum when they were capping it off. So in order to guard against the water shooting in too fast, I'm going to take the meaty part of my thumb and my middle finger, and I'm going to squeeze this plunger pretty tightly so that when I stick it in, it doesn't just shoot the water in super fast. That can damage the peptides. So again, on the vial, there's a little tiny circle in the middle. You want to aim for that little tiny circle, and you just want to push it in. And as you push it in, you're going to feel that thing want to start to pull. You're going to try to hold it. Once it's in, I'm going to aim it towards the side of the vial so that it's not shooting straight into the peptides. And then I'm going to let it slowly release as I rotate the vial to get all the water in there. And I just let it keep pulling, let it keep pulling, let it keep pulling until it's all the way in. And then I go ahead and pull it out. Once it's out, you can roll the peptides like this, I guess swirl it like this. You can tip it back and forth, or you can roll it in your hands like this to try to help dissolve any of the remaining lyophilized powder that's stuck in the bottom. This one, there is not a lot on there. Usually when you're putting 3 milliliters in, it usually helps to dissolve it quicker, but not all the time. Sometimes this one, you can see there might be a little bit of white still up at the top here. So I'm just going to roll it back and forth like this, swirl it a little bit, and usually that will take care of it. Sometimes you need to do this for a couple minutes to get all of it to be dissolved, but after that, it's all ready to go. So that is as hard as it gets, and you'll be a pro at doing this in no time.